Hello, Cal State LA students. Thanks for logging in to watch this online version of the Introduction to Health Careers presentation. My name is Maite Villareal Rodriguez, and I am the Health Careers Advisor here at Cal State LA through Health Careers Advising Office, otherwise known as HCAL. At HCAL, we advise students who are interested in careers as doctors, either medical doctor or doctor of osteopathic medicine, physician assistants, optometrists, chiropractors, dentists, pharmacists, podiatrists, occupational therapists, or physical therapists. Now, these are not majors. There is no pre-health major or pre-med major at Cal State LA. And during this online presentation, you are going to learn what it means to be pre-health at Cal State LA and the basics for how to prepare for a career in health while you're a student here. A quick note, we don't advise for nursing or public health. If you are interested in a career as a nurse or in the public health field, you can contact HHS Advising Center if you are wanting to get support and direction in that area. So during today, as you watch this presentation, these are the topics that we're going to cover. We'll discuss why now is a good time to start thinking about your health career, what we do as the Health Careers Advisement Office, what it looks like to actually think about the health careers and prepare in a way of reflecting for those careers, and then preparation in a practical sense. What does preparation actually look like academically, through gaining experience, through entrance exams, through building relationships, staying healthy, reflective practices, finances, and that will cover the basics of preparation. We'll also cover some of the linkages we offer through Cal State LA, talk about some career paths and what the practicals of that looks like, discuss a bit about how our Cal State LA alumni have done in their outcomes of gaining admission, and take a survey that you'll need to complete in order to get a one-on-one appointment with myself as the pre-health advisor. So as you watch this, you may be a first-year freshman or a senior getting ready to graduate. So why should you be spending time thinking about a health career now? Well, some goals are so significant, so large, so important that you have to plan way ahead and break it down into small pieces and small achievable goals in order to accomplish the big goal. So I'll give you a personal example. My family likes to watch MMA together. That's mixed martial arts. One of the cool things about MMA is that there are women that are very involved in the sport. These are tough, hardcore women. They are top athletes. You don't want to mess with them. And they are really serious about what they do. They're very competitive. Now, I have two daughters of my own. One is 2 and one is 4. And I'm an educator, so of course I want them to go on to achieve in school and become professionals. But let's say, hypothetically, I wanted them to become professional MMA fighters. Now, what would that take to get them at that level of these women that you see in front of you? Well, let me show you a current picture of them. Now, I picked this picture out. There's Anaya and Soraya because you can see they have some fighting potential, right? You can see Anaya kind of has Soraya in a chokehold, and the baby sort of has a mean look on her face. You know, that could be cultivated. But what would it take to go from these little girls to those hardcore women from the screenshot before? They would need to train. They would need to change their diet from, Cheerios and mac and cheese to leafy greens and proteins. We would have to get really serious about what their schedule looked like. They would need coaches in different areas of their life. So nutrition, exercise, competition. They would need to get feedback along the way from professionals. Like, is this a pipe dream? Are we on our way? They would have to be super clear on their goals, not just them, but, our whole family. The same is true for pursuing a health career. It's a big, huge, challenging goal to achieve, and you can get there, and you probably have the potential that can be developed to get there. But you need to start early. You need to break it down into small tasks, and you need to get feedback and support and coaching along the way. And that is what HCOW is here for. So our mission is to provide excellent resources to mobilize our diverse student body to successfully enter health profession schools and serve in communities of need. I want you to just notice that word successfully. I want you to know that our goal is for you to reach your goal and actually get in. Why is that? Healthcare is super important, and communities in need students just like you to become healthcare professionals, because many of you understand what it's like to need healthcare and to perhaps lack the best healthcare. And from a place of understanding, you can provide in that area in a really unique way. Also, I want to mention that it's a great time to be a CSU student. It's not at all a disadvantage. Health profession schools are looking for diversity, not just in ethnic background, but also in the kind of schools that students are coming from. For example, they have lots of students apply from UCs and private schools, but not as many from CSUs. And so they're looking for students from CSUs. So if anything, it actually can be an advantage to be at a CSU right now on your way to a health profession schools. You just need to be ready. So we want to help you get ready so that you can really shine. I want to give you a little bit of background on Cal State LA and how competitive the candidates are currently. So this includes undergrads and students that do their post-bac here at Cal State LA. So each year, about 75 students from Cal State LA apply to medical school. Some are current students and some have already graduated. And of those 75, about 20 students are accepted, which is around 26%. About 66 Cal State LA students apply to PA school, and about 11 of those are accepted, which is a 16% rate. Around 55 students from Cal State LA apply to pharmacy school, and roughly 33 are accepted, which is a 60% acceptance rate. And 20 students from Cal State LA apply to dental school, where 6 students or 30% are accepted. Now, I want to point out that oftentimes students apply before they are ready or consult HCOW. What this means is they just want to see if they can get in, and there's things about their application that are not quite strong enough yet. That's why it's so important to connect with HCOW, with advising, and with the services we offer so you can apply when you're at your strongest. And also sometimes students limit themselves to only schools in California. I recommend applying broadly. One of the reasons is because many students all across the country want to come to California, so it's actually harder to get in California. For example, across the nation, there's about 2 applicants for every 1 seat in medical school. In California, there are about 10 applicants for every 1 seat in medical school. So, those are some of the things that you'll learn as you connect with us. This is our structure with HCOW. Because there are so many pre-health students at Cal State LA and only myself as a pre-health advisor, I've created the structure that's going to help meet your needs without necessarily needing to have a one-on-one appointment more than once per semester. Now, the first stop should always be the website. I'm going to point out a couple features of our website, which is calstatela.edu/healthcareers. So as you can see on our website, the very first thing is to register as pre-health. If you haven't done that, I recommend that you pause this video and take a moment to do that right now. This is what's going to get you onto our HCOW database, and that way you will get weekly newsletters, which include all our on and off campus opportunities, including workshops, panel presentations, volunteer opportunities, internships, job opportunities, summer projects, free practice tests, mentoring, scholarships. Everything that we offer students, you get through those weekly newsletters. So I'm going to encourage you to register as pre-health. So in order to take full advantage, you're going to need to register and read those. So just to scroll through the website and, oops, sorry, that email popped up. Okay, so you're going to notice here that we have all the different health careers that we advise for. So let's say that you want to be a veterinarian. You can click on pre-vet, see your prereqs, see some really helpful and important links, and explore that way. The website is broken up into 3 categories: explore, prepare, and apply, depending on where you're at in your process. You can also see our information, where to find us, with a map locating us directly. So that's our website, and encourage you to really explore and find what's there. We're going to come back to it a little bit later. Okay. Beyond the website, which is right here, we have a number of additional support and opportunities. Nearly every week, we have workshops on topics such as gaining clinical experience, study skills for pre-health students, how to pay for health profession schools, writing your personal statement. And we also invite guests from health profession schools to host sessions where you can learn about a variety of health careers. So we also host admissions deans to come and give tips on application and learn about opportunities in and out of the United States. We also partner for events with the Pre-PA Association, I Am Pre-Med, Pre-Health Scholars, and Pre-Health Dreamers, which are all active campus orgs in the different health fields. Along with these clubs, we host events on campus, such as a pre-health fair that's coming this spring. There was the Pre-PA Expo in the fall, and we also did an ethics panels where practitioners talked about how they handled complicated ethical issues. Encourage you all to really take advantage of these opportunities and come to as many events as possible. Next, you'll see there's a course on this triangle pyramid here. I'm teaching a class called Introduction to Health Careers, which is listed as NSS 3540. It's going to be offered each spring and possibly other semesters as well. Keep you updated. This is a great opportunity for freshmen and sophomores to learn about the range of health careers, as well as learn early on what it takes to really be a competitive candidate. What you don't want is to be in your junior, senior, 5th year and finding out that you're not competitive, either because of your GPA or your experiences. So we want to expose you to those realities very early on and help you get prepared. There's still time to register for this spring, but if you're watching this later on, then you could join in another year. Also, just a reminder that I, as the pre-health advisor, am not your primary academic advisor. You're still going to have an advisor through your college, whether that be NSS or HSS or Arts and Letters. You should be regularly checking in with them. They'll make sure that you're meeting your degree requirements in order to graduate. Now, once you've watched this online presentation, or if you also additionally go to the in-person workshop and you complete the survey, then you're eligible to make a one-on-one appointment with me, which you can see at the top of this pyramid. I offer 2 types of appointments. One is a 15-minute appointment where you can schedule a meeting or just drop in if you have a really specific question. And another is a 45-minute appointment when we need to go more in depth into planning or any concerns that you may have. So just as a reminder, the way to stay in the loop about all of this information is to register as pre-health. So if you haven't done it, again, go ahead and pause, pull out your phone, and register now. Now, in a moment, I'm going to talk about some of the challenges and sacrifices that are involved in being pre-health. But before I do want to acknowledge that a career as a healthcare practitioner is an amazing and honorable pathway to pursue. I love this Dr. Seuss quotation. To the world, you may be one person, but to one person, you may be the world. If you are that patient that's, let's say, going to the dentist and you're deathly afraid of the drill, your dentist is the only person that matters at that moment. If you are taking a family member to the ER and that doctor or that PA in charge of the care of the most important people in your world, that's all that matters. It's an amazing honor to be in that role. Or let's say you're recovering from a car accident, or a physical therapist is the one to help you get back to work. That means everything. So I'm excited for each of you to be pursuing this career path. That said, it's important to reflect on what that path actually looks like. And here's some important questions to ask yourself. Do I like and do well in science? A career in health is a career in science. Science is the fundamental building block, basis, and pursuit of a career in health. What kind of hands-on patient contact am I open to? There's different health careers, and some are very hands-on, literally like a chiropractor. Some do not involve as much, such as a pharmacist. But you want to know in advance, right? I have a student recently who realized that she can't really handle the sight of blood, and she's already in medical school. That would have been something to know earlier on. Now, not to say that there's nothing she can do about that, but you really want to reflect on, am I open to, patient contact? Do I like people? Can I work on a team? More and more healthcare is becoming an allied team endeavor, which means you're going to be working not just you individually with patients, but on a team with other healthcare practitioners as well as social workers, maybe pastors, maybe insurance agents. It's really a team sport. Can you work on that? How do you do under pressure? Some people, they really love being in a situation where they're called on under the pressure. Others are really wanting to have space and time and not needing to do things immediately. Again, there's a range of health careers, but there's always going to be situations where you're going to need to react quickly. Are you open to that? Is that a skill you can work on? And what is often not our students' favorite, are you up for a lifetime of test taking? Now, you will need most likely an entrance exam, and we'll cover that later. But not just that. Once you're in health profession schools, there's usually tests, large standardized tests that you need to take to continue on. And then you'll need to continue taking tests as you continue in your field to make sure that you're up to date on all the latest technology and medical advances. And also, are you ready to be in school for 6 to 12 years? Of course, at a minimum, finishing your undergrad is about 4 years. And then PA school, let's say, is another 2 years. But often you will go on longer than that. Medical school is 4 years with often another 3 to 4 years of residency, with on top of that, often another 2 years in fellowship. Are you okay with being in school for that long? These are important things to reflect on. I want you to pause and take a moment and ask yourself, which of these do I feel great about? And which of these are more of a stretch and a struggle for me? And also, have you explored multiple health professions? This is where it's super important to explore our website and explore opportunities like at explorehealthcareers.org to really know your options. It's not just doctor, nurse. There are so many things that you can do to satisfy your desire to help people and your love for science. Now, first and foremost, you have to prepare academically. What does that look like? Well, first of all majors are welcome in the health profession school. So major in whatever you're going to do best. You don't have to be a biology major, a biochem, a chem major. You should major in what you love and what you feel like you're going to perform well in. Schools are looking for students who have demonstrated that they can do well, particularly in their prerequisite courses, but also who followed their interest. Regardless your major, you will need to complete your prerequisite courses for health profession schools, along, of course, with your GE and your major requirements. So as far as the prerequisite courses, pretty much for all health careers, you're going to need a year of general biology with lab, a year of general chemistry with lab, a year of physics with lab, and a year of math. Typically, a semester of calc and a semester of stats will do the job. Additional courses will vary by health career. So, of course, you're going to want to look at the website and make sure that you're following what you need to be doing. And I do want to mention that every school actually might have slightly different requirements for their prerequisites. So once you start looking at schools, you're going to want to check out their websites and make sure that you're taking the prerequisites for those classes. We can give you a guide, but we cannot provide you a comprehensive list of every requirement that every school needs. That'll be up to you to really do that research for yourself. A note about AP courses. I recommend retaking them. Some schools take AP credit and some do not, but in order to maximize your options and be able to apply everywhere you want, you should retake those courses. And also it gives you another grade to show that you can handle those science and math classes at a college level. Now, I cannot stress enough the importance of a strong GPA. So oftentimes schools will say, well, we look at students holistically, and what students hear when they say that is, oh, okay, well, if my GPA is not that strong, I can make up for it with, a lot of activities or clinical hours or leadership roles or even an awesome test score on, say, the MCAT or the PCAT. But the reality is that you need the GPA in order to show them that you can handle the coursework at a more accelerated and intense level. So they look at the GPA first, and then they move on to looking at, your activities, your hours, and your leadership, etc. It's not to say that it's impossible to get in with a low GPA. We're going to talk about that later, but don't fool yourself. GPA is fundamental. You got to show them you can get those grades and do well in those classes. Competitive GPAs, you really should disregard what the minimum is. Sometimes you'll see on a website that they have a 3.0 minimum, but that doesn't mean that that's what students that are getting in have. You want to focus on what the average admitted student is getting. So for example, there might be a 3.0 minimum, but the average admitted student might have a 3.7 GPA. So you'll want to look into that difference. Another thing to mention is that at Cal State LA, we have a course repetition policy where if you get a C- or a less in a class, then you can actually repeat that class and replace the grade on your transcript. For almost all health professions programs, you will need to actually include that grade in your overall transcript. So that will bring down your GPA a little bit, even though it will still be worth retaking the class in order to slightly bring up your GPA. Now, if you're watching this and you already have a low GPA, it's not over for you. There is a way to come back from that. But it starts with really reflecting on why do you have a low GPA? Sometimes it's something as simple as how you are studying. For example, study shows that highlighting and rereading are not effective ways to absorb information. Self-quizzing, for example, is proven to be a way to absorb information. Or even where you sit in class. If you sit in the front or in the middle, the studies show that those students actually perform better. So have you really taken a step back and reflected on how you study, where you study, with who you study, what classes you're doing well in, what classes you're not doing well in, and really dissect why you're not performing as well as you need to be. I'm happy to walk through that process with you and really get real and honest about what is going on and make a game plan to come back from a low GPA. Wherever you are, you can course correct for a grade trend. So what I mean by that is that, schools are looking for that positive grade trend. Let's say that you didn't do as well your first year or during a semester. Have you proven that you have come back from that and showed a positive trend in the right direction? Or have you been sporadic or even showed a negative grade trend? You want to show that upward trend to know that to show them that you can perform well. Retake classes that are C- or below. So again, even though that lower grade is going to get counted in, well, for your prereqs, you at least need to pass the class. And on top of that, it will slightly help your GPA to average the grades between the grade that's less than a C- and the repeated grade, hopefully an A. Also, if you've gotten C's in classes, I wouldn't recommend retaking those classes. I would actually recommend continuing to take upper division science classes, because it doesn't show much to say that you do a little bit better in a class you've already passed. What is a stronger point is to do really well in even more rigorous classes. Also, consider your options after graduation. You might want to think about an alternative pathway. There are many health career pathways. Some have more rigorous and competitive GPAs that are required, and some don't. Are you open to switching that up? Consider a post-bac program, which can help you improve your GPA, or if you haven't taken your prereqs on time, you can take them through a post-bac program. There are also non-US programs that are accredited that are great options. They're just offshore, and you can learn more about that through our workshops. Okay, moving on to gaining experience. Now, there's a variety of different types of experiences. The purpose of all of these is to help you develop personally, and I encourage you to think about it that way. It's not so much a checklist, but it's really a process for you to get out there, get involved, get connected, and know beyond a shadow of a doubt, do I want to do this for the rest of my life? Do I love it? Do I benefit? Do I have something to offer? And these are all kind of scenarios that allow for you to ask those important questions. So your freshman year, I want to encourage you to really focus on your grades and just join a pre-health club on campus, but not do much more than that. It's a big transition between high school and college, and we want you to be able to focus on that transition and not prematurely jump into a bunch of different activities. But then after your freshman year, I think it's a good idea to start volunteering. Volunteering is really any service to others. It doesn't necessarily have to be in a medical setting. There are students who work in after-school reading programs, who feed the homeless, other activities like that. Go with what draws you, and then you will start to focus on what is referred to as a community of interest. So a group of people or a population that you're drawn to and you're wanting to serve in a really specific capacity. Then you're going to want to gain some clinical experience and exposure. Now, there can be overlap between volunteering and clinical. So you could volunteer at a hospital. But clinical, you will want to get some specific patient contact. So that's any setting where healthcare needs are being met. I also recommend for those of you that are working to even pursue a certification as, say, a certified nursing assistant, a medical assistant, an emergency medical technician, or a phlebotomist. The benefit of getting one of these certifications is that you kind of kill two birds with the one stone, because you get really great direct patient contact and you accumulate hours and you get paid. So these programs, you can't get these certifications at Cal State LA, but many local community colleges offer them. So you'll need to take a month to 6 months to get certified, and then you can start working. And I can give you more information about that in person. Also, once you've been involved in a student org, consider, taking on a leadership position or increasing your involvement if that's something you're drawn to see what you can do, not just to participate, but to help lead other students in that. And then lastly, there's research experience. It's not a requirement, but particularly for medical school and pharmacy school, this is something you really want to look into because many applicants have research experience. There's ways to get on-campus research experience because most of our faculty actually have research labs. And there's also lots of opportunities off campus, which you can find online through our website. And again, I can give you more information about this in person as we meet. Shadowing is direct focused observation of practitioner-patient relationship. It's tough to get shadowing experience, but you can get in there through networking. It might take 20 to 40 tries and asking around, talking to your practitioners, talking to myself, but you can get there. And this is where you are not volunteering, you're not helping, you're not doing anything with patients, you're just watching a practitioner do what they do. But you do often want to secure these hours in order to report them when you're applying, in order to really see. They want to know, have you seen somebody do what you say that you want to do? So again, use our website to find information. You can ask me for recommendations. I have specific places that I can love to recommend you. And very important to record where you're going, where you went, the hours you spent there, what you saw, who were you with, and what you learned. And we have tools for this on our website so that you can keep track of that. Once you actually apply, you're going to need to report all of that. And so it's important to not be scrambling at the last minute, but to really record that along the way. Also, you'll need to prepare for an entrance exam. So you're probably going to have to take one, as you can see here, for each of the fields. Most likely, you will have to take that test. The content is covered in the courses that are required for that school. So for example, for medical school, it's going to cover chemistry, biology, physics, biochemistry, cellular molecular biology, sociology, psychology. So the same classes that are required for entrance to the program are the topics that are going to be covered in the test. So I recommend that as you're taking those classes, you could just get a cheap set of prep books, or even here at our resource library through HCAL, you can look through and reference those so that as you're in that class, you can actually take a look at what it takes to do well in that class and what it takes to do well on the entrance exam, because you'll be learning that in the class, but the way that they might ask on an entrance exam may be a little bit different. I recommend studying for these entrance exams the way that you study for your tests and do well on. So if you study alone and that's the way that you do it, then study alone. If you study in groups, then study in groups. So this is not supposed to be super different from the way that you have found to be successful in your classes. Also, consider taking a test prep course. About 40% of students do. Now, that means that 60% don't, and there are plenty of free resources online. But we also offer scholarships and discounts through our partnership at Cal State LA, and it can be really helpful to have that accountability and those added skills of professionals who can walk you through how to really do well on these tests. Next is prepare by building relationships. I really recommend you to connect with like-minded peers. So find your people on campus. Anywhere that you go, you're going to find people that have that same pathway. And when you do, link up with them. I love the story of Tatiana and Jamu, who are Cal State LA students, who met in a class and realized that there was a need for more resources for students on campus. So they formed I Am Pre-Med, which is a really active club on campus. And they've really supported and helped each other throughout the way. And they kind of spread the love and brought other students into that. Find your people, study with them, keep yourself accountable, go to these meetings together, link up, don't do it alone, and get involved in a student org. That's where you can find your people because they're going to be drawn to those same activities. Also, build relationships with potential letter writers. You're eventually going to need letters of recommendation from faculty, from supervisors, and from a practitioner. And so you're going to need them most likely from at least 2 science faculty. So you want to be building those relationships, asking questions in class, going to office hours, finding out if you can help with research, so that when the time comes, you've had that relationship and you can ask. I also want to mention that Cal State LA does offer a committee letter, which I recommend applying for. And there's information about this on our website. Prepare by being on time. Now, I know this sounds pretty obvious, but literally it is huge. Be on time wherever you go. You don't want to be known for being the person that's late. Be on time to class. Be on time to your advising appointments. Be on time to office hours. And practically, be on time by using the pre-health guide by stages. So again, this is our website, and I've broken it down stage by stage, what you should be working on and when. And so I recommend that you really utilize this to know that you're on track. As you can see, it's many things at every stage of the process that are helpful to be focused on. So I encourage you to really use that guide. Consider glide years. So that's time after you graduate but before you apply. This is a job that you're going to have for the rest of your life, and time is on your side. You don't want to apply before you're ready. You want to apply when you're strongest. So definitely plan with myself and with friends and, those people that are helping you along your way when the best time is to apply. But again, I typically encourage students not to apply right out of school, but to use that time to develop professionally and, if needed, academically. Also know that your application is considered based exactly on the information when you apply. It's not that you can say, hey, I'm going to get better grades in this year off, or I'm going to do all this clinical experience. Trust me. No, they are going to look at it based exactly on what it is as you apply. Also, be aware that disciplinary or legal issues will show up on your application. So that doesn't mean that you're disqualified if you've gotten into some disciplinary or legal trouble. But of course, by all means, stay out of trouble if you can, so that you don't have to avoid that. And I just want to mention the importance of staying healthy. Now, take care of yourself. You don't want to lose yourself in this process. As you consider going into the health field, remember that it matters that you actually stay healthy. Burnout is real as a healthcare practitioner. Remember that you got to take care of yourself. It's never too early to start integrating these health practices, which fortunately we have a lot of resources at Cal State LA available to you. You can take a KIN class each semester. You can utilize CAPS, which is the Counseling and Psychological Services, and get counseling here on campus. You can connect with orgs that align with your spiritual beliefs that can help you grow in that area. And you can connect with people through all these campus orgs. So really encourage you. Also, don't forget to not just do, but to actually reflect. This is the number one thing that I hear from admissions officers it's lacking for students is a practice of self-reflection. So try and actually think, what am I doing? So what? What is the meaning of that? And then now what? What's the next step? Also, Cal State LA offers a number of great linkage opportunities. And what this means is that we have agreements with certain campuses where they actually hold spots for our students. It's not a guarantee of admission, but it does mean that they really want our Cal State LA students. And if you meet minimum requirements, it guarantees you an interview and drastically increases your chances of getting in. So currently we have those linkages with Western University, the Health Science, Marshall B. Ketchum, and Lake Erie College of Osteopathic Medicine. They have multiple programs each, and there is a follow-up workshop on this, but please inquire because this is an amazing opportunity to secure a spot in one of these great institutions. Also, prepare financially. So be aware that it can really add up just being pre-health. I won't go through everything, but I encourage you can pause this and take a look at how it adds up. Volunteer fees, background checks, your application costs, and then of course the actual tuition, which ranges from $71,000 all the way up to $275,000 just for tuition. That doesn't not even include room and board. So be aware, don't be scared. There's an amazing amount of opportunities for scholarships and grants and loans, but know what you're getting yourself into and, don't spend all your financial aid money out the gate because you're going to want to save as much as possible. I want you also to pause and take a look at this basic info chart and find the occupations that you are open to. This just gives you some basic information about what the degree is, how many schools there are, how many schools in California, how many years in training, what the competitive GPAs are, and what the average salaries are. So this will help you just get a sense of what you need to do and what you need to be aware of as you head towards this. So the good news is that our students are getting into these programs, and you can even pause here and look at some of these awesome institutions that some of our students have recently been accepted to. And fortunately, many of them are willing to come to campus and talk about their experiences, and I would be happy to connect you with them directly as well. Now that we've reached the end of the online presentation, please visit the URL that's on the screen right now so that you can complete the survey. And once you've completed the survey, then you're eligible to meet with the pre-health advisor, which is me, in a one-on-one appointment. So finish up the survey and I will see you soon.